going to talk about the connection between Tylenol and autism on this segment. And we're also going to talk about other Tylenol side effects that you need to know. First and foremost, this is not medical advice. I am a chiropractor. I cannot give any drug advice, even over-the-counter drug advice. So this is not medication advice. I'm not saying to take or not to take anything. If you have any questions about that, you talk to your medical physician. What I'm going to be doing on this show is presenting you research out of journals, which is available to anyone. So I'm sharing you research, not giving you medical advice. I'm going to get into some side effects of Tylenol, and then we're going to talk about the Tylenol autism link in a moment. First up, long-term use of acetaminophen, Tylenol, doubles the risk of blood cancers, such as leukemia, lymphoma, multiple myeloma. That is out of the Journal of Clinical Oncology in 2011. So I'm going to quickly quote the journal research so you can go pop that up and chase it down if you want to. Next up, may cause liver failure and death. I think a lot of people know about the liver issues and acetaminophen and Tylenol. Acetaminophen hepatotoxicity, liver toxicity, far exceeds other causes of acute liver failure in the United States. 51% of U.S. acute liver failures caused by acetaminophen, especially with alcohol. And that's out of the journal called Hepatology in 2005. Next one. 1,000 capsules of Tylenol in a lifetime, not necessarily in a row, but in a lifetime, doubles the risk of end-stage renal disease, end-stage kidney disease. So now we're talking liver toxicity, kidney issue possibilities. We're not saying, nobody's saying that that's absolute, but possibilities with that. That was New England Journal of Medicine, 1994, so that's a long time ago. Increases high blood pressure is the next one. Compared with non-users, older women who consumed over 500 milligrams per day for headache had a 240% increase of hypertension. And then another segment, compared with non-users of Tylenol, younger women who consume over 500 milligrams per day for headache had a 370% increased risk of hypertension. And that is out of the journal Hypertension in 2005. Now here's the autism link. This is very important. As far as I can see now, at least what I'm aware of, there are 6 good studies linking autism, the increased risk of autism and Tylenol use in pregnant women and to young children. Okay? So pay attention. Here we go. Increases the risk of autism and autism spectrum disorders when Tylenol is used during pregnancy and early childhood. Here are 5 of the 6 references. Environmental Health in 2013, Journal of Restorative Medicine in 2013, Entropy in 2012. I think this is a European journal. ACTA Neurobiologica Experimentalis in 2010. I think that's, again, European. Alternative Medicine Review in 2009. I'm going to break down one of those references carefully for you. This is, again, the Journal of Restorative Medicine in 2013. The lead author is William Shaw. And just so you know, this one article has 84 references. So there's a lot of other material backing up what these authors are saying. Here's the title of the journal article. Evidence that increased acetaminophen use in genetically vulnerable children appears to be a major cause in the epidemics of autism, ADHD, and asthma. So now we're talking not just autism, but we're talking about the increases in ADHD and increases in asthma. The percentage of the population in the United States with autism is 298 times that of the population in Cuba. 298. It's not twice as much. It's not 10 times as much. It's 298 times as much as it is in Cuba. What this is suggesting is, yet vaccines are compulsory in Cuba, and Cuba has one of the most highly vaccinated populations in the world. They're highly vaccinated in Cuba, like we are in the United States. The practice of prescribing acetaminophen as a prophylactic fever preventative is widespread in the United States, but is very uncommon in Cuba. So what these researchers are suggesting is that in the United States, we regularly give Tylenol to kids when they're getting shots. In Cuba, they say, no, suck it up. Here's your shot, no Tylenol. In the United States, we're like, here it is. Here you go trying to be a preventative, okay? Here's a sixth reference in that train. This is new now, this is 2018. Prolonged use of acetaminophen during pregnancy is associated with an increased risk for autism and ADHD. And this was a fairly large group of people that were used in this research article. Investigators found a 30% increase in relative risk for ADHD and a 20% increase for autism spectrum disorders in children whose mothers took Tylenol during pregnancy compared to children whose mothers did not. The reference is American Journal of Epidemiology in April of 2018. The perception out there is the only drug that's safe for pregnant women that you can take is Tylenol. Now again, I am not suggesting to or not to take any of those, but what this is suggesting is maybe it's not as safe as we are told. That's what this is saying. My colleague, Dr. Dan Murphy, sent me all of these articles. Thank you, Dr. Murphy. And he said, based upon these studies and the treasure trove of additional references found in their bibliographies, I would suggest that pregnant mothers and children not be given products that contain acetaminophen ever. There are other researchers and doctors that very much feel that way. So then what do? We have pain, we have headaches, we have aches and problems and so forth and fevers. What do? Quickly, my suggestions are as follows. There's always chiropractic. Myself as a chiropractor, I have been in practice 28 years, and I have seen thousands of people come to me. Oftentimes, people will try chiropractors as a last result for the aches, pains, headaches, migraines, whatever's going on, even for their children with fevers, even for their children with illnesses and ear infections and so forth. And they'll come in as a last resort, and we see just wonderful things happen. Try chiropractic, and no, chiropractic is not going to work on one visit. Well, that's why do we talk about looking at somebody who might take Tylenol with 1,000 pills in a lifetime? Because people will take these things repetitively in a desperation move of trying to get better. So what we're looking for is other answers, and that's why I'm a chiropractor and I try to give people alternatives. Next, clean diet. A lot of us have the SAD diet, the standard American diet. It's an inflammatory diet. It causes systemic inflammation in our cells and bodies and organs and systems and glands. It turns us to inflammatory chemicals instead of anti-inflammatory chemicals. If we clean up our diet and we eat the cleanest diet that we can tolerate, typically people in chronic pain and with headaches and so forth, good things happen. Typically good things happen. Regular exercise. We move our body. Joints feel better, blood feels better, heart works better, more blood flow, more release of chemicals to make us feel good. Those chemicals inhibit pain chemicals and so forth. Regular exercise to your tolerance. Enough sleep. We get enough sleep, repair happens. Most of the repair happens when you're resting and so forth. Reduce stress. Enough said about that. If you're under chronic stress, you release the chemicals that increase pain. Enough water, but not too much. Anti-inflammatory supplements make sense. Omega-3s from fish oil, antioxidants, magnesium, probiotics, and so forth. Those are the alternatives. I'm Dr. Scott Fuller. Join me again.